Jeremy, you said, by the way, I don't do consults or calls whatsoever and still enroll members in my annual program where they get stellar results. That sounds like something exactly I've said. What do you mean? Can you expand on this? Okay, well, what I mean by this is that there are different ways to run a practice, right? So every practitioner is going to come in with their own foundational level of skills in various departments. That's fine. Part of my job is to keep mine extremely sharp, right? So that I can kind of lead from the front here, but also be able to identify where certain practitioners have skill gaps and what can we develop so that we can open up different possibilities if you choose. Now, some practitioners say, okay, I want to do like fractal systems and all that, but I'm not comfortable taking on a new patient or client or whatever member without having a call with them. Fine, great, do calls. Like, I'm not going to come to your house and like publicly shame you because you're still doing calls and consultations. That's not a problem. It's about taking it in stages. And actually, calls and consults can be really good, really powerful when you're getting started with these systems. So you can have actually a linear base, and you can start to non-linearize the different components of your practice if you want over time. You can take it step by step. This is a skillful thing to do. Calls can be good because you're going to be talking to people, and you're going to be, if you want a script, I can give you a script, I'll put it in the resources. But basically, if you're going to be talking to people, you want to have some kind of standard skeleton of the conversation. When I was doing calls, I got off scripts too. Like I was done with that, and things could be more organic, and I would still get all my points made. And I used to make jokes about the different, even like acupuncture consultations I've done in contexts that are just bananas. I mean, I did a new patient consult once while I was sitting on a toilet. You know, I mean, it's like you don't need a script. At a certain point, you're just a pro and you know what things you need to talk about. And the reason why I was sitting on a toilet is because it was at the gym, and there was a guy I was working out with, and we both went to the bathroom at the same time, and you know, I could hear him in there, and he just started asking me questions about his shoulder pain and this and that. So I mean, I was literally pooping and talking to somebody about their doing a consult. So you get to a certain point, you don't need the scripts and the crutches and all that, and you get to a certain point, you don't need the consults really at all if you have systems underneath. So online is really a great avenue for that. You don't have to get rid of consults. You don't. You can use them for a while. You can get market research. You can get your feet under you. You can get some people coming in. You can get beta testers. Like, there's lots of ways to phase in to a nonlinear practice that are gentle. It's like walking into a pool, right? What I'll say about that is that, for one, I like to be at the edges of this stuff. I want to know what's possible. It's like a 4-minute mile, right? So if practitioners come in and everybody assumes we have to have calls, 1-hour calls to get somebody into your program, well, I want to break that assumption, and I'm going to do it in front of you publicly, and I'm going to say, listen, that's not true for me. So whatever this assumption is, it's now a choice. You can choose to keep the calls, or you can choose to try without doing them. But you can't just do it with no call. You've got to have everything like netted together underneath so that you can be responsible with the people coming in. I know when I say this stuff, it's like, okay, I enroll people into high-ticket annual memberships for health issues with no calls, no consultations. I have no appointments, right? I know that sounds bold. It sounds fucking nuts, right? And it almost sounds reckless or irresponsible, right? Oh, how are you helping the people then? You must just be doing a shitty job. You must just be giving them all the same treatment. Not at all. Not at all. You've got to have the right systems underneath, and then you earn the privilege to run your business like this. That's just kind of all there is to it, right? If you do the work and you get things laid out the right way, and yes, I go into this in the program, and yes, even the systems I have, members have access to just grab and copy the stuff I've built, which could be like weeks of work to make the right kind of application with 100 questions on it, organized the right way, with the right kind of wording to elicit certain thoughts and start to get to know people in a way where you can navigate their case via an application. They can just grab it, right? So that's part of like a membership perk. I don't have to do this stuff, but I make it available where you can swipe it, and it's not like swipe my 10 headlines for Facebook ads. It's deep stuff. This is a functional tool that you can use, and when you start putting people through this, and you can modify it of course to fit your needs, but when you start putting people through this process, you'll find that the application is so well designed that you get enough information to make an accurate diagnosis. Depending on your skill set and clinical clarity levels, you can make an accurate prognosis. You can start to figure out places where people are probably going to go sideways and what to do if that happens. All these things are possible from the information. Oh, how do I take virtual patients? I can't take their pulse. Well, that's a belief, right? There are definitely ways to get pulse information from people without putting your fingers on them. I'm going to leave that one open, something to think about. But these are problems that we can solve. We can approach all this stuff. In fact, I have. So I use this a lot. When you have that kind of application process, it's also not uncommon for people to go through that and they actually learn a lot about themselves. I've had people cry. They come back and tell me, I filled out the application, please take a look. I hope I'm accepted into the program. I actually cried halfway through when I started really thinking about these things. This stuff can be medicinal, right? To bring people to revelations where they're getting clear so that they can communicate to you clearly, they have to get clear themselves. I've designed systems where this happens, right? And there's similar things here, like with Doctors Club. It's not just, hey, Jeremy, I like this. Here's my credit card. Let me in. It's not that. There's a beefy and thorough application between guests and annual membership here. And it's so I can really get to know a practitioner deeply. And that process also can be pretty revelatory. I've had practitioners come through and they say, listen, I was filling out this application and I actually learned a ton of stuff. I've got a lot of really great ideas and insights about moving forward just from thinking about these things that you asked me on the application. Why I'm getting at with this is that you can create real connection and deep thinking without having to be in the room with somebody or on a call with them. I can do it with a form, right? But it's not some bullshit form that I just cobbled together, right? It's intentional. There's principles underneath. Everything's weaving together to support this kind of superstructure that contains the person's whole deal and then organizes everything. So yeah, I do that, right? So that I don't have to do calls. You can do both. You know, you could have a form and you could have a call afterwards. Like, okay, here's your confirmation call. I just want to go over some stuff with you, ask you a couple questions. There's no rules on this, right? This is art. Now, how much structure you have underneath, how much pre-solved problems have we handled, right? That kind of stuff can set you free a lot faster. So this question is like, by the way, I don't do consults or calls whatsoever, and I still enroll members in my annual program where they get stellar results. Yes. And then this question goes on. So are these wrong beliefs too? Herbs should be customized to get the best result. No or yes. Okay, well, that's binary. So what I'll say is that when you start to understand your niche or your niche vertical, right? If you don't specialize in a niche of like Lyme disease or mold illness or fertility, right? If you're kind of more of a general practitioner, you can still do that online. You can. The thing is, once you start to understand your verticals, you're going to see commonalities there. So as you get better at Chinese herbs, and this is something we do in Clinical Clarity, that's why there's hours and hours of trainings on this stuff in the program, so you can get deep and you can see what I can see with this stuff, because I've had fucking outstanding mentors. Outstanding, right? There's great teachers everywhere. I haven't studied with every single teacher, but a lot of them, I've met some genius people, and I've taken very good notes, and I've asked them very good questions, and I've synthesized something that I think is going to stand the test of time. So when we look at Clinical Clarity, you can start to see certain interventions, whether it's herb formulas, breathing exercises, food therapies, whatever. There are certain things that are going to be big movers for people, like 80-20. They'll do 80% of the heavy lifting. And I know there's like, this is starting to become a trend in Eastern medicine. It's like, okay, well, let's look at the clinical simplicity and let's do 80-20 thinking and all that. Let's look at the bell curve. It's good. It's a good place to start. You got to understand that there are going to be some things that will do the bulk of the heavy lifting for most people. That doesn't mean you can give that to everybody. We still have to have a flow chart, right? An algorithm of differentiation. So the way I've got things set up with my Clinical Clarity systems for the niche I'm working with and the verticals I work with within that niche or those niches is that I've got certain herb formulas that I differentiate between. And when I look at somebody's application and I'm looking at their presentation and all their signs and symptoms and I'm doing the math on all that stuff in my head, which it does take time, you've got to analyze these things, I can see most likely how they're going to fork and diverge through my clinical algorithm. And there's going to be herb formulas that kind of live at each one of those intersections and nodes. Now that's the 80-20, right? That's the 80%. There's also custom granules and things like that. But what I've done is set up systems where I have the big formulas to do the heavy lifting first, and then if there's any kind of lingering symptoms, then I know how to either change the dosage on those, the timing on those, recombine those, or we move into custom granules where I'm still doing a mental flow chart of which custom granule formula should we go to next and next and next. So what we get with that kind of system is that instead of having to sit down with somebody and write a custom everything, you're starting to do modular thinking where you can move around certain herb formulas that are going to have big effects that are systematic for the person, and then if there's anything left, which oftentimes there's not, but if there is anything left or weird stuff or they're starting to get UTIs or something like that, then you can move to something more customized. So what we do with that then is we've now freed up our bandwidth because our delivery, our program delivery, it's not watered down and generic where we give everybody the same thing. We have a lot of options for customizing formulas themselves, but we also can customize the person's navigation through formulas that are not customized. So we balance the universal and the unique with that. And this is something that a lot of practitioners have a hard time with. It's this forced binary thinking, like, okay, well, you either have a standard protocol and you're just pushing everybody through some group program that's generic, one size fits all, or you're taking fucking 3 hours with each case and looking up the Shanghun Lun and feeling their pulse for 20 minutes and making this super perfect custom. It's not. It's both. It's both. We need to bridge that. We need to become skillful at navigating both of those things. It's not yin or yang, right? It's both. We need to understand this stuff. We can run our business aligned to natural forces. This isn't just fluffy hyperbole when I say this stuff. When you start to understand the dynamism and get out of these forced binaries, two-corner fallacies, right? Customized herb formulas are the best for people. Okay, go to China and go see how that goes, right? Most people in China are not doing customized herb formulas. They go to the little herb pharmacy and they grab Huoshang Jiangqi or Xiao Chai Hu or whatever off the shelf and they use that first. They start with something standard that fits their presentation enough. It's close enough. And then for people who whatever's on the shelf isn't working, then they go see the doctor. Right? In our culture, we don't have the off-the-shelf stuff. So people are coming in and we think we need to come in with like super custom everything all the time, when actually we need to provide a first layer that's basically just like an over-the-counter pharmacy that's got guidance to it. It's not just a shit show, right? You can navigate people like, okay, these are kind of the over-the-counter type herbs. They're very safe, low amplitude. They tend to help with this kind of presentation or this one. For you, it's probably this one. Start there. Whatever falls through the cracks, then we get that with like Dr. Brain, right? So these things are myths, right? It's just a misconception that it's one or the other. And it doesn't mean you're wrong, right, to think this way. This is just what we've been told. A lot of my job is exploring these training glitches, these assumptions that we just pick up. The next question expansion here is, are you saying herbs can be standardized to your ideal customers in your group? Well, sort of. I think I explained that. Have you built your online system practice just using TCM or some functional medicine into it to get extra clinical clarity? I personally don't have a need for functional medicine. I don't need it, so I haven't brought it in. I'm not opposed to it. When the need arises, I'll bring it in. Every now and then, we'll use things like minerals, trace minerals or Irish sea moss or something like that. Different things, sometimes people do well with like, they take bentonite clay or things like that. Like there are some things I bring in, but I'm not doing labs or any of that. And I have a lot of reasons for that, but I have expanded my Eastern medicine thinking to the point where I can operate independently of functional medicine. So, I personally don't need it. And again, this is me going to the edge and saying, okay, well, in a world where there's no functional medicine, can I still help people? Yes. Right? Now, if you want to add functional medicine in, again, I'm not going to come to your house and shame you and go, oh, this person's in my program, but they're using functional. No, use it, right? But use it skillfully. Organize a clinical algorithm where you know where the Eastern stuff, the functional stuff, where it all fits. Because not everybody needs every single lab test, right? Just like not everybody needs every single herb. You said we don't need 1 hour for new patient consults. Then you said you see complex cases. So my question is, how do you get all the information you need to have a thorough understanding of your patient's case? Yes, well, first of all, I've got a very thorough understanding of the physiology and the pathology of how this stuff works and how people tend to present with illness. This is something that we've talked about this at summits. I've got some content in the program about this. The Eastern medicine's like specific herb formulas and things like that, we tend to bring those up in the group chat as needed when different members are going through case studies and things like that, or you've got a stubborn case and we're talking about different herb formulas and all that. I can make training modules on Chinese herbs specifically and how I'm doing everything. I can teach you that if that's something that people want. But for the most part, most practitioners that come in, they already have a foundational understanding of Chinese herbs to some level, so I don't need to go repeat the materia medica and make it into a program, right? Now, that being said, I've got some software I'm building, clinical clarity software, that I think is going to be a fucking massive game changer for anybody using Eastern medicine, herbs especially, but acupuncture too. Some of the summit members have signed non-disclosure agreements on that, and they've actually seen some of this stuff at work, and I think this is going to be really, really fantastic. So we do a lot of stuff with Chinese herbs. That doesn't mean that everybody who comes into Doctors Club has to know Chinese herbs. Right? It's something that we can make accessible. So this question of, you said we don't need 1 hour for new patient consults. Okay, well, you might, and that would be okay. I don't. Well, I got a battery thing. I don't, and I just want you to know that that's possible, right? I don't do the consults at all. Now, I've studied in China. I watched Dr. Jin Zhao seeing 150 to 200 patients per day, masterfully, writing sort of customized formulas for each person, sort of. 3 minutes, 4 minutes with each patient. And these aren't just, oh, I've got a cough, right? It's people coming in with stomach cancer and little kids with weird illnesses and people with anxiety and their hair's falling out and what, like, complex cases, autoimmune stuff, all these things. And it's not because he's a wizard, right? He has a foundational knowledge base, which is extensive and very, very good. He's, quick, takes the pulse, looks at the tongue, asks a couple questions, and he writes a formula up. He can do it very quickly without it being shit. He does a really good job, and that's why he's got, a line of people out the door. Some of them have driven hundreds of miles to come see him, which means in China, you're driving from province to province, driving past literally thousands of other doctors to go stand in line outside his office, right? He's doing something right. So it's not like he delivers fast care, that sucks. He can do this without a 1-hour consult for every single patient. Absolutely. And so when I was talking to him and we were I was like mapping his brain out one night in California, we stayed up late and just the two of us got into a corner in the kitchen table and I got my notebook out. And I was just asking him. And it's because he's got a process dialed in. He's got an algorithm. He knows where things are going to go. He's got some sense of the universal and he knows when to pivot to the unique. So he can be very quick and very accurate and very precise at the same time, right? All three of those things happening. This is something that is not like nobody can learn this. And part of my job, as I see it, is to start bringing this kind of awareness to more and more practitioners. And we're starting with Doctors Club, right? It's just this deeper, high-touch kind of stuff. But yeah, you don't need to do a 1-hour consult if you don't need to do a 1-hour consult. Right? So if you've got your systems in place and you know the map, then you can ask some questions. You can figure out where they are on the map and where they need to be going next and how to help them with that via herbs, functional medicine, breath work, food therapy, homeopathics, whatever your tool set is, right? But my kind of piece is to say, let's organize our thinking. And instead of having a grab bag of heuristics, which I've got info in the vault on that, where you're trying to pick out which clinical pearl is going to help the person, and you're doing inductive reasoning, which means guessing, right? Taking valid evidence and then guessing about what it means. Instead of that, we can have an organized clinical algorithm where we have our clinical pearls are threaded and we now have navigable strings and pathways. And we don't have to do inductive reasoning where we're taking a little bit of evidence and guessing. We can take deductive reasoning where we're looking at the whole picture and figuring out where somebody is on that. It's a whole different deal. So newer practitioners, you might not be at this level. That's okay. That's what we do here. We bring you up, right? That's fine. I want you to know what's possible. You don't have to do it exactly how I'm doing it, but I want you to know that that's not impossible. If somebody tells you can't have high-ticket health programs, 5 to 10K for an annual membership, they're wrong. It's possible. If somebody tells you have to do sales calls to even enroll somebody in a high-ticket membership, they're wrong. It's possible. I do it with no calls. If somebody tells you, and that's just the business side, if somebody tells you have to do a 1-hour intake on complex cases, they're wrong. You don't. Dr. Jin Zhao wasn't doing that. Right? I should have come and told him, hey, you need to spend more time with your patients, right? Come on. He knows what he's doing. At a certain level, you don't have these constraints. If somebody tells you that you can't treat people without doing customized herb formulas, well, they're wrong, right? We can actually use standard herb formulas and customize the order and the flow with which a patient goes through that process. You could try that before you start tweaking all the little things, right? High leverage movers. So I hope this helps this kind of question. It's a cool question. I know that the stuff I'm saying is like, depending on your perspective, it can be kind of mind-blowing. These are things that I've accumulated over years and years and years. I've just been making steady incremental progress in all directions. Personal cultivation, fractal systems, clinical clarity, and at a certain level, all this stuff starts to tie back together and feed itself. It becomes an organism. And I know when I just start to share that without the context, it can be like, what are you talking about? You're nuts, right? But there is a process here. There's a path here. And I'm not done. Right? I'm not done. It's not like I'm done with personal cultivation. It's not like I'm done with fractal systems. It's not like I'm done with clinical clarity. These things give us infinite room for learning more and more and more and more and more, which is why it's fun and exciting. But at a certain point, you've got competency in those to a level where you can do things like the business model that I'm running, where I have annual memberships that are high ticket with patients that are committed, and they follow up on their treatment plan, and they take their herbs, and they get better. And I manage them with customization when necessary, and I'm not irresponsible with their health. I care, and I look, and I listen, and I pay attention. I ask very skilled questions that reveal a lot of information, and I'm very strategic and surgical with that. But I've designed systems around that so that I can still do a damn good job and have time to live my life. Hope that helps. All right, get to work.